When they start out on a robot, the amount of times they have to convert to lap or open is much less. So we use that sort of data to say, is a robotic case more expensive up front? Yes, there's some costs associated with the machine itself and the disposables. But when you look at decreased blood usage, infection issues, dehiscence, length of stay, it more than pays for itself when you look at the continuum of the patient's care.
Clock in, scrub up, and join us behind the red line. You're listening to First Case, a perioperative podcast bringing you exciting interviews, engaging discussions, and innovative solutions that are changing the way patients receive surgical care. Each episode, we talk to frontline staff, perioperative leadership, and nursing entrepreneurs from across the country as they share their stories, experience, and expertise on the industry we love. From the back table to the boardroom, from wheels in to wheels out, we tackle the real-life issues affecting the OR. Whether you're tuning in for surgical service education or inspiration, we're glad you're here. And now it's time to roll back and start the first case.
On this Vendor Spotlight, Melanie and I will be speaking with Robbie George. He's the Vice President of Surgical Services at Ballad Health. We're going to be talking all things robotic-assisted surgery, and we are also going to discuss some opportunities towards standardization and optimization in the context of robotics in a collaboration with Cardinal Health Presource. So, Melanie, I know that you and I have had a chance to meet Robbie, and I think that people are going to find him to be not only informative and interesting, but just a really great person to listen to talk about his experiences.
I agree. And I think there's a lot we can learn by hearing somebody's lived experience and actually hearing them talk about what they've done so that we can hear how it applies to us and how we could put that into our situation. So there is a lot to be learned from his experience, talking about, like you said, standardization and efficiency, and even hitting on the topics of communication and education and how that can improve our efforts when we look at standardization. So there's a lot to learn today.
All right, everybody, you are really going to enjoy with this one. Stay with us. We'll be right back after a short break.
From the studios of Healthcare HQ, you're listening to First Case.
Joining us now is Robbie George, Vice President of Surgical Services. He's got 25 years of healthcare experience and over 20 years in surgical services, both at the facility and corporate levels. We're going to have Robbie talk a lot more about that, but I also want to tell everybody about Ballad Health, created in 2018 when the Mountain States Health Alliance and Wellmont Health Systems agreed to merge. They're headquartered in Johnson City, Tennessee, and include facilities in Tennessee and Virginia. We're going to be talking about robotic assisted surgery. This is one of those topics that, boy, it was 20 years ago, something that sounded space age, and now everybody's doing it. So, Robbie, thanks so much for coming on the show.
Thanks for having me, Justin.
So I did kind of give a little details on your career, but I would just love to hear more about your whole path. You know, tell us about yourself, but maybe more the story of your career journey.
Well, it started back 27 years ago. I graduated from a local university here in Johnson City, Tennessee, East Tennessee State University, with a bachelor's degree in nursing. Went on to work med-surg unit at a local hospital. Found out very quickly that was not going to be my career. About a year and a half of that, decided that it was time to find something else to do, and didn't know what my passion was at that time, and made a pivot that I was going to go to ER or OR. Went to the OR, immediately found what my passion in my career was going to be, fell in love with it, spent a lot of time at the Level 1 Trauma Center, learning as much as I could about surgery, whether it was trauma, general surgery, vascular, orthopedics, neuro, and then just kind of leapfrogged from that into some management positions. I started running the OR board, moved on into some more leadership roles like clinical leader, OR manager, made a pivot more to the business side and got involved with the vendors and supply chain. For a while, I took a job at corporate where I was the medical equipment planner, which was a great period in my life. For about 2 or 3 years, we designed a lot of new OR suites, hospitals with one of our legacy systems. And even though I enjoyed it, I realized it was time to get back into the clinical world. So I took a job as an OR director at one of our rural hospitals in Southwest Virginia and was really just delighted to be there, built some great relationships, and really planned on retiring at that facility. But then this position opened up to oversee all of surgical services for Ballad Health. And it was the next step in my career. I call it my dream job. I get to work with some great people, great physicians, great leaders here. It's just a joy to come in and work.
From somebody who currently works in a rural hospital and your experience in a rural hospital, I'm really curious what it was like going from big hospital down to working at the rural hospital level and how you adapted to direct such a different type of healthcare.
And I know from speaking with you previously, you're an OR person, so you understand that every operating room has its own culture. And there's a huge difference from a level 1 trauma center with, 18 rooms to a 4 or 5 OR rural hospital. My comfort zone was always in those smaller ones. I felt like you could build a more intimate relationship. It's not just that department, but you develop tighter relationships with your lab, with your radiology, with the nurses upstairs. It's just that hometown type feel. Even though I was commuting 45 minutes, I built relationships in that town that I still have. I've been gone for 3 years and I'm very close with some of the surgeons, the anesthesia providers there. I'll always have a tie to Abingdon.
That's really cool. And I agree. Now that I'm in a rural healthcare setting too, you really do have a different culture, but you really get to know everybody. And it's a different experience for sure.
It is.
Well, and this is such an interesting background, Robbie, and I think the thing that stands out the most is your passion. And so I can just imagine, when robotics started to emerge, you must have gotten a little excited about what it could mean or how it could change surgery, right? For how we deliver it, all kinds of different aspects. Were you on it right away? The minute you saw it coming along, were you attracted to it? Or is it something that you kind of, just had some experience in and then all of a sudden became, kind of an expert in it?
Well, it's kind of an odd story. I'm always pulled to the technology piece. I love the technology that we could see in the operating room. And when the Da Vinci first came out in 2008, it was a little daunting. It was a bulky, time-consuming. It was very limited when they first brought this on the market. It was used as a way to, for lack of a better terminology, you put billboards up, you drove people to the hospital for a procedure for men's prostatectomy, right? Nerve sparing. They didn't have incontinence issues. And it was very, very limited. I was at that time really engaged in the different types of products in the spine, the different screws and rods and those sorts of things. So I didn't really pick up on it till 2 or 3 generations later when they started to refine the Da Vinci. It started to get a lot of competition. They expanded the service lines, getting more into general surgery, GYN oncology, those types of things. They could do more and more procedures, more value in it. And the actual machine itself was much more, I hate to say intuitive, that's the official name, but it was instinctive somewhat to the physicians, much quicker to dock, better usage of the technology. So it's kind of been an evolution to get used to that piece of it.
What do you think really drove that? The growing use. What do you think is contributing to that? And I mean this less from the design innovations that you just, talked about. I'm thinking more along the lines of what's happening in our industry and on the front lines that's also contributing to that. Because, if you've ever seen new disruptive technologies or read books about it, and I always think of like Malcolm Gladwell's The Tipping Point when I make a similar kind of comment as this one, but there needs to be a convergence, not just of design and manufacturing, but also of need and market shifts that are happening. What did you see kind of evolving over that time?
A lot of things this is kind of a complicated answer to that because there's so many things happened at the same time. You had competition coming into the market around the robots. Everyone saw where this was going and started to develop more and more technology. At the same time, Intuitive, being very forward thinking, they could see that coming to the market. So they heavily invested into education. They got upfront into medical institutions, teaching residents, putting residents on those consoles, getting them used to it. I'm old enough. I can remember back in the day when we went from open to laparoscopic. And a lot of the guys doing it said, this is a fad. We'll never go to this. And then you had residents coming out of school that never did open procedures. They were so used to doing laparoscopic. Now we're seeing that same mentality with the robot. If you want to get a surgeon, especially general surgery now, to come to your facilities, the first thing they ask is, do you have a robot? And am I going to have access to that robot? So it's just that evolution of the technology. It used to take 45 minutes to bring the robot in, to drape it and to dock it. They can do this in 5 minutes now.
Oh, wow.
So there's technology concerns and education as well.
Are there other benefits to the surgeon that you've seen that have really helped them kind of dive into that?
There's so many aspects to it now. The actual robot itself, if you've looked at it, it takes the tremor of the hand out. It allows the limitations of the human wrist is taken away because the robot arm almost functions like an owl's head. It can almost do a 360 spin. Then they've married that with the technology of the data behind it. There's video behind it. We have the ability now at Ballad Health, we have the hub that's on all of our robots to where if a physician is doing a case and they're having issues, they can have another physician jump in and see where they're at in the abdomen. They can see the video. They can speak to them audibly. They can do telestration on the screen to help walk them through that. And so we're collecting data, and we can see that when physicians are doing, for example, a laparoscopic case, their prevalence or the amount of times they may have to convert to open. When they start out on a robot, the amount of times they have to convert to lap or open is much less. So we use that sort of data to say, is a robotic case more expensive up front? Yes, there's some costs associated with the machine itself and the disposables. But when you look at decreased blood usage, infection issues, dehiscence, length of stay, it more than pays for itself when you look at the continuum of the patient's care.
One of the things you said really kind of perked my ears up. You talked about how the robot takes out hand trimmer when surgeons are operating. And it made me think about yesterday as I was in the OR and we were doing a lap chole on a patient. And once again, I work in a rural hospital. We don't have a robot, even though the surgeon who's there was a resident who trained on the robot and he knows how to use the robot. And now he has to do things laparoscopically because that's just what we have. But he also only has 2 surgical techs to help him. And he would have to set his ports, get his camera in place. He would get things where he needed it. And then he'd say, okay, hold still, don't move. And then he'd walk around to the other side of the patient. He'd look at something else. And then he'd work over there for a little bit. And then, okay, hold still, don't move. And then walk back. And so you see all of the lost time and the frustration of going back and forth, things moving, things getting out of the way, when you could take that and reduce that time, hold things still and have it right where you need it to be so you can see what you're doing. That really connected the dots for me, thinking about hand trimmer and movement when you said that, because I watched it happen yesterday in a lap chole.
Yes, it's exciting. It really is. And the technology, one of the things I get excited about is we're at the point now to where, as I've talked with people, this type of technology is going to be used, I think, with the military. They're going to be able to send out a vehicle that can pull a man in or a woman and be able to do, a battlefield surgery with a physician in another country. So you could literally pull someone on, dock them on a robot with a tech in the field and do life-saving surgery. That's where we're at today. That to me is very exciting.
No, it is super exciting. And to think about the ramifications of saving more lives and being able to have access to expert care and then drawing that down to the patient, whether we're talking about our military members out in the field or we're talking about our patients in the hospital. When we think about our patients, there are a lot of benefits to robotic surgery that our patients might not even realize that they are benefiting from when we think about the current opioid crisis and how robots can reduce use of opioids and other things like that. Can you speak to the benefits that our patients enjoy because they had a robotic surgery?
Oh, definitely. We had been met with Intuitive just last week. We're the fastest growing robotics program in the South right now. And it's around things like you mentioned, opioid abuse. Many of these patients would require multiple nights stay. We do a very acute procedure now, the ETEP, for hernia repair. We've talked to some of our surgeons. These people will require extensive incisions, a large piece of mesh put in. The physician would come in the next day. That patient would probably spend the night on the ventilator, couple of days in the ICU, maybe another 2 or 3 days in the hospital. They come in the next day, the patient's sitting in the bedside chair, they're eating breakfast, and they go home by noon with no opioids or, a couple of days. It's just really impressive to see what we're able to do in cutting down these massive incisions that could have a relapse, a recurring hernia again, the blood that we're not having to give the patients, not having to have long-term catheters that could lead to infections. It just goes on, and cutting someone's length of stay down from 7.5 days, possibly down to a day and a half, getting them back to their highest level of well-being, getting them back into their jobs, into their communities. It's just exciting for us to be able to provide that to our community here at Ballad Health.
It seems like being able to offer robotic assisted cases coupled with ERAS protocols that we have all talked about and we have pushed in advance for patient care, they go hand in hand to lead to those better patient outcomes, right?
Yes, I'm glad you mentioned that term, robotic assisted. We spoke about that. You would be shocked. The community, we have to do a better job of educating our community, because so many people come into offices and say, now, will my surgeon be there? And we're like, yes, the robot is another tool that we're using to help you. It is not being performed by a robot. It's simply another instrument that our surgeons are using to help them. And ERAS protocols, we're expanding that at Ballad Health. It really started around general surgery, colon type procedures. We're rolling that out to all services now. Orthopedics has picked it up this year, and we're now moving to where it's the default. If a doctor doesn't want to have ERAS, he has to click to come out of that protocol. Wow. It's the default to put that patient into it.
I love that. That is really cool.
Let's go a little bit deeper into your program. Honestly, Robbie, you kind of teed it up really well. What kinds of procedures are you doing at Ballad Health, and how did that evolve over time? Tell us a little bit about your specific story.
Yeah, it's been very interesting. The first da Vinci we ever had was in 2008 at Johnson City. And at that time we had not merged. And so the legacy system across town apparently had a couple of systems as well. And now you fast forward to today. Over the last 3 years, our growth has been phenomenal. We now have 13 of the XI robots. We had those at 7 different facilities. We're also branching out. They have a new pulmonary robot, the Ion. I'll talk about a little bit about that later. We have 2 of those currently. But as I spoke out originally, it was basically for prostatectomies. Now we're seeing we have a GYN oncologist that's doing all kinds of procedures on it. General surgery's doing minor cases like gallbladders, but they're able to do very advanced hernia repairs. They're doing colon resections. It just keeps expanding. We have GYN doing procedures on it as well. And urology still does quite a bit on it, but it's going into more and more service lines. And you're seeing vascular surgery, or thoracic, I should say, now doing lung cases on it. And that's really an exciting area of growth, thinking about going in more into the chest and the benefits that patients are going to see when they're having surgery done through ports between their ribs and not having to have their sternum opened up, and with all that implies, and the length of stay and pain and those sort of things that they have to go through.
So Robbie, maybe give us some demographics, number of procedures, and maybe talk to us a little bit more about how the program is growing just recently.
Yeah, it's really exploding. To date, we've done a little over 18,000 procedures on our da Vinci robots. Just for a little insight into our growth, over the last 6 months, we've added 3 robots. In December, we were averaging about 320 cases a month for the system. Now we're doing over 420 cases a month.
With that kind of volume, I'm sure, and you see this anytime somebody scales up, whether they scale up a business, they scale up a service line, like there's always opportunities for increased efficiencies, right? All of a sudden you start to see, oh, wait, we could do this a little bit better. How do we reduce our times? How do we do this? Have you been working on any specific, kind of, I guess, strategies to help you be more efficient now that your scale is growing so significantly?
I'll talk to you about three of them. One, the first of the year, we hired a system-wide robotics manager that reports to me. She has jumped into the field immediately and has been working not just by service, but by individual robotics surgeon, looking at preference cards, looking at the instrumentation they use. And so we have that piece going on. We also have the surgeons themselves, their relationships and their ability to work not just with their own partners, but with some of their competitors. They're meeting monthly. They have a hernia collaborative where they meet, they bring in speakers. They're looking at each other's techniques. They're looking at the instrumentation they use. It's great to see that kind of spirit of wanting to get better. And we have that here at Ballad Health. And then working with Cardinal, they've been a great supporter of ours, looking at our packs. How can we get everything we need for a robotic case in one simple pack to where when they open it, if they're going to use those products 85% of the time, they're ready to go. It cuts down on that preoperative setup and what that we need to pull going into those cases. So it's those three things alone have been huge. And then once again, some of the analytics, we can now measure the hand movements on the robot, how many times they're taking instruments in and out to get quicker and better at what they're doing.
You mentioned some of that standardization effort around those packs. And, we've had a lot of conversations with Cardinal Health and a lot of the success that they've had in delivering efficiencies, by putting these packs together. But I got to think that robotics is different. How are robotic packs different from maybe more standard surgery packs?
Well, that's a great question. Of course, you've got the drapes. You're using arms on this robot that instead of having a free-held stapler or a suture, it's built into the arms, those sorts of things. The cameras are different. So many things are different on it, but there's a lot of similarities that you would use on every robotic case, whether it was a vascular, whether it was general surgery, urology. So that's the sort of things we're trying to get. It's very eye-opening, whether it's robotic or even laparoscopic, because Cardinal's helped us with this before. When a surgeon walks into the room, they've got their hands held up, they're looking for a towel, and they just want you to clean their hands, put their gown and gloves on, and get to work. They don't know where this came from. So it's very eye-opening, and they're great to work with us when they walk in a room and we opened up a pack and they're like, oh, well, this hospital, this pack has 6 of these on it. This one only has 3. And that's how we get them together to say, we're making up these differences in wasted time and running around to pull single use items off the shelf. Let's get this all condensed down if you're all going to use the same thing into the pack. And then these physician preference items that are all different to you, we'll pull those things. So Cardinal's been great to help us out with that.
We did the exact same thing with Cardinal at my last facility, and it was a lifesaver. I was the team leader for orthopedics, and we looked at our different orthopedic surgeons, and Cardinal worked right along with us to be like, hey, you're using all of these things, but these aren't specific. So why don't we make it standardized in this area, and then we'll just pull the surgeon-specific items. And it made things so much faster for us when we were getting our cases pulled, set up, and ready. It was amazing.
Faster, and if you can combine all those items in your pack and you've got one sterilization, you're getting everything so much cheaper.
Oh, yeah. And
it's just a route to go.
Great. Mm-hmm.
That standardization piece, I'm sure there are ways to optimize too. And I'm just wondering, I got to think education is really important here because you're talking about supplies, right? And, as a nurse, you know what supplies you need, but you don't necessarily know the best options out there from a price standpoint and just really how many of these do we need, et cetera, getting some of that intel, from a data perspective. Maybe as a leader, you have a lot more insight into that business side and operations, but to actually go in and work with the end user and the surgeons, I got to think you needed some support from the educational standpoint on that as well. Cause you just mentioned all of a sudden their awareness of all of that instead of just like walking right in and go, it has increased in sort of this standardization effort.
Definitely. We have a great relationship with Intuitive, but they have a business model that sometimes conflicts with what the hospitals have. So we have made it a point, our robotics manager, every robot in the system has a laminated sheet that shows all the Intuitive supplies, the actual instrumentation, and it varies greatly. Just having that on a robot, as you talked about education, it's communication as well. The docs look at this and say, there's really not any difference in this $50 grasper versus the $150 grasper. And as they're having these meetings, they're hernia collaboratives, they're discussing it, they're learning ways to use one instrument. They can use it 2 or 3 different ways to where they're not open to the other. So it's education and communication, because if you don't communicate it right, it comes off to staff and physicians as you're just trying to cut corners, you're trying to do things cheaply. And really, if you'll just educate them and show them, typically they're very agreeable to want to do what's best for the system and for the patient.
I love that. I guess I just really agree with the statement that it's education and communication, because once we know and once we understand, then yes, we can see how you're not telling us to cut corners or do things quicker or just to save money for the hospital and don't care about the patient, right? It's actually, we care about the patient and we also care about the business and the hospital. So let's do what's best for both. And how can we do that? And once people are educated and you've communicated clearly, everybody can get on the same page. And I think it's really helpful when you focus on that communication and education.
And you learn. You do it wrong one time.
Yeah, right.
And trust me, I've been there. I've done it the wrong way before I learned the right way to do it. So you get some very upset people.
Oh, yeah.
You've stepped into their sandbox and caused problems. And it's like, yeah, that's on me. Yep. I didn't
mean it that way.
Correctly.
Yeah.
Yep.
You're talking about some challenges, right? Specifically around communication. But this is really kind of my last question other than sort of looking to the future before we wrap up. And it's really about resistance in general, maybe from, the various hospitals or staff to utilize robotic surgery. And, you always think about how do you overcome some of those challenges or navigate them. Maybe you don't always overcome them. Maybe they're a legitimate challenge like this. Oh, this really, we didn't think of this. This isn't going to work this way. Can you talk about the process of navigating some of that resistance that sometimes come up with adopting a technology that I realize has now been widely adopted, but just along the way?
When you say resistance, it comes in a lot of different forms. You have resistance with the physicians sometimes who do not want to look at the new technology. And so a lot of that is just taken care of by peer-to-peer. We're not in any sort of way pushing our doctors to move to something they're not comfortable with. But as they work amongst themselves, that resistance is torn down. A lot of times it's resistance from the staff. They're afraid of this new technology. And quite frankly, we had to change our communication. When this came on board, we communicated to people, hey, we want you to be a part of the robotic team. It's this elite team. It's very special. You have to learn this. Now it's evolving so quickly. It's like laparoscopic surgery. Everyone, you're going to have to learn how to do this day, night, weekends, all the time, because doctors are wanting to use this on their add-ons, on the weekends. And so it's not just a few people, but everyone's having to learn it. So, and there's resistance internally. When I discussed some things earlier about concerns around cost, but then you have to break down those barriers by showing there's a front end cost to this, but the benefits, the throughput issues that we're solving when we've got people waiting in ERs because they can't get a bed, we're getting people out of here in half the time. There's benefits on that side to using robotics. So there's resistance at all corners.
All right. Well, let's paint a really positive picture of the future. Like what is the next steps for robotic surgery? Obviously continued advancements whenever you talk about technology are to be expected. What can we kind of what can we have on our radar?
Well, we've not even talked about robotics for orthopedics. That's huge right now and continues to grow. What I'm most excited about, we talked a little bit earlier about the Ion robot that's come out now. We have got 2 of those currently in Ballad, and it makes it possible to perform peripheral lung biopsies in some very hard to reach bronchial tubes, places that would normally require very invasive surgery. We can now use some very small incisions. We don't affect healthy lung tissue. And what we're finding is an incredible need for this. And as we go in and do these studies, we're finding the yields on tumors are extremely high, much higher than we anticipated. So the dream and what we're working at here is, and not every patient's going to require this. When you start looking at lung tissue and nodules, they're not all the same. Some are going to require chemo, radiation type treatments. There's a lot of scans involved, but some of them are going to require a surgical intervention to remove that tumor. And so with the ion, we're finding much smaller tumors, much smaller out. And so the goal is going to be, if we bring a patient in, we want to consent them for one procedure. We'll bring the ion robot in, do the biopsy, read the result. And if it's the correct technology, the correct outcome, we're going to immediately, without waking that patient up, bring the Da Vinci in, have a thoracic surgeon go in, remove that tumor. And so it's one anesthetic event. They've not had their chest cracked open. They could go home the next day. That's the dream. That's where we want to get to take care of the people in our community the way they need to be taken care of.
That's phenomenal. And Robbie, you were phenomenal. This is such a great discussion, and you were absolutely the expert. This is really incredible. I think one of the things that came out the most for me, actually, in listening to you talk, is how connected to your community and that sense of duty to your community that echoed. Like, we never once said it so directly, but it was woven in. And I think it's got to be a major source of what motivates you, to consistently be looking for ways to improve.
Yeah, it's odd. We're a big system. We go into Virginia. When I worked at that small rural hospital in Virginia, I commuted 40 minutes to it, but it kind of became, for those 8 years, and even now, that's my community as well. You get tied into where you're at and you just fall in love with it.
Well, Robbie, thanks so much for coming on and having this conversation with us today. I truly enjoyed it.
It was great.
That was Robbie George, Vice President of Surgical Services at Ballad Health. And what an incredibly in-depth overview of all things robotics, robotic assisted surgery. I love that clarifier. Melanie, you had mentioned that, and he emphasized how important that is, but also, he's working at a very high level to create standardization, but also to innovate and to really serve the community. One of the most genuine people that we've had the opportunity to interview, Melanie.
100%. I could talk to him all day just about his experience and see if I could be the sponge absorbing his knowledge as he talked. But you think about, yes, he's the vice president of surgical services. And so he's got this big 10,000 foot view of the whole program, but he's also been at the front line. He's been the clinical person as well. And he hasn't forgotten that in the process. And so having that well-rounded experience and bringing that to his department is only going to make his department even better because he's bringing all of that to the table.
Yeah, I thought he really lit up when you asked him what it was like to, work in a smaller rural setting. And, you could just see his heart is really into it. Speaking of standardization, as we kind of wrap this up, I do want to encourage everybody. There were some positive standardization opportunities that were discussed as Robbie was partnering with Cardinal Health. And specifically, you can reach out to Cardinal Health Presource for additional solutions to help drive efficiencies and innovation in the OR. Obviously, robotic packs are one of those areas, and this is one of 3 in a series. So we're going to be learning about some of those other opportunities while we educate ourselves along the way and hear from inspirational leaders like Robbie. So really enjoyed this vendor spotlight today. And on behalf of Melanie and myself, thank you all for listening to this vendor spotlight on First Case.
Thank you for listening to this week's episode of First Case. As a reminder, you can help support us by subscribing to First Case on your favorite podcast app or by downloading the smartphone app on iPhone or Android. Simply search for First Case in the App Store or Google Play. The best thing about downloading the smartphone app is that you can access bonus content for certain episodes and view episodes in certain categories, like articles on the go and vendor spotlights. Are you following us on LinkedIn or Facebook yet? If you are and you love an episode or post, then let your social network know about it. Like, comment, or share our posts along with your thoughts and keep the conversation going. If you have any topics or guests that you would like to recommend for a future episode, just send us an email to info@firstcasemedia.com. We look forward to hearing from you.